evening. We are at AHPICON Madurai, the Tamil Nadu chapter. We have with us Dr. Mohammed Rela, who has achieved the Lifetime Achievement Award today. Sir, many congratulations.
Thank you very much. Thank you.
Sir, when we talk about healthcare, healthcare has a very important role in the development of a country and the economy. What role does healthcare has in the development of India, and what future do you see?
Now, India is a huge population. The healthcare industry in India, I would say, has only been growing for the last 20 years. 20 years ago, most of the service providers were government providers and very few private sector was involved. Now, but the government sector has been very slow to grow, to provide for the whole of the population. So the government itself relies on the private sector for provision of services. And the private sector has had the advantage of investment in a big way in terms of equipment, in terms of cancer care, in terms of transplantation. Now that India has progressed so much in healthcare, I mean, I do liver transplantation. I worked in the UK for almost 20 years before I moved here. I was a professor of liver surgery at King's College Hospital in London. And when I moved here about 12, 13 years ago, liver transplantation was not done at all in India. And the outcome of the ones done very rarely was very poor. The public confidence in such high-end surgery was not very good. Today, in the last 10 years, medicine has evolved so much in India, to some extent in the public sector and to a great extent in the private sector. India stands number 3 in transplantation in the world, only after United States, China, and it is India. And now many of the countries, the surrounding countries, are coming to India for really treatment. If you take Myanmar, Bangladesh, Sri Lanka, all of these countries are coming for high-end treatment to India. And now we are even having a switch. The Middle Eastern countries, instead of going to the West, they usually go to the UK, United States, and Germany for treatment. They are looking to India for treatment, high-end treatment. And that shows how well India has evolved in the field of medical. It's not just for the benefit of Indians alone, but also for the benefit of countries around India. So I would see that as a huge progress.
That's very insightful, Doctor. I also want to understand what is the role of AI, telemedicine, technology, and robotics in liver transplant and healthcare in general that you see in India.
AI is picking up in a big way. There are many concerns about AI. You may have heard, even the Pope was having in the G7 summit, speaking to the world leaders about the dangers of AI. But in the healthcare industry, there are specific areas where AI would be helpful. Particularly if you develop an algorithm for diagnosis in radiology, in pathology, you could get the expertise of 1,000 radiologists in one go, rather than training a doctor to look at 1,000 slides to learn. AI can learn it in one second and make a decision based on the understanding of 1,000 cases or 2,000 cases in one go. So that has to be useful for the public in that way, AI. Robotics, again, is coming in a big way, and India is also really embracing robotics in a big way. I do most of the donor operations in liver transplantation by robotics, because the robotic donor operation doesn't give a scar. If you actually look to see who is donating for who, parents donate for children. They don't worry about scar. But when older adults want transplant, the younger people donate, young adult. For example, a 20-year-old girl has to donate for a 50-year-old father. A 20-year-old girl having a big scar in the abdomen is not a good thing. I mean, they have to get married, the boys may not like it. So robotics and minimally invasive surgery is helping a huge amount in really developing this sort of operations and for making it more acceptable for people. And I think robotic surgery is going to be the future of abdominal surgery.
Lastly, Doctor, I want to understand your views about the role of doctors in promoting equality and humanity?
I think humanity, equality are very important. Ethical way of treating patients probably is the most important way. Now, if you talk about equality, that may be very difficult in the private sector. So, if somebody is not able to afford treatment, I think the funding should come from the government. Whether the treatment is done in a private hospital or a government hospital, it should be available in the government hospital in the first place. When it's not available, the funding should be provided. So, healthcare should be accessible to everyone, not to only people who have got money for carrying it. I think in our state, in Tamil Nadu, we have found here, anybody who requires a liver transplantation is now fully funded by the government. Other states are lagging behind a bit, but I'm sure that will come. And equality can only come through governmental intervention. It cannot be privately done. But as long as these hospitals can provide ethical practice to everyone, not just thinking about the money, that is the most important thing, and that's the most important point for the private sector, that the work has to be ethical.
Thank you so much, doctor. Thank you for your time. Thank you.